Hi, welcome to Draw Your Pain Management Strategy. It's 7 a.m. at the start of your morning shift. On your handover, there's a patient called Eva, a 44-year-old presented with chronic non-specific low back pain. You greet her at her bedside, but she immediately voices her pain in her lower back and asks for pain relief. What do you do? Well, like any discerning health professional, you start with evidence-based practice. Suddenly, a book falls down and hits your head. Very convenient. How to defeat chronic idiopathic low back pain. I guess we'll have a look. Well, this chapter looks interesting. And yeah, it's a systematic review. It says low back pain is one of the major causes for disability in the world. Common recommendations for low back pain include advice and education and exercise and physical therapy. But where's evidence for it? Which intervention is more effective than the other? These were the questions that the authors of the review sought to investigate. After filtering through 6 databases, they identified 120 papers, out of which there were only 4 randomized controlled trials that met their criteria. Firstly, let's look at Ryan et al. The advice group had 1 education session on pain biology and were given a back book, whilst the exercise group had 6 sessions of circuit training. They found the advice group more effective in reducing pain. On the other hand, these 2 studies, Torstensen et al. And Sherman et al., found exercise to be more effective than advice in reducing pain. The yoga group in particular, in Sherman's study, comparatively reduced pain, whilst there was no statistically significant difference between the exercise and advice group. Lastly, Hartvigsen et al. This study found no difference between the 2 advice groups and the supervised Nordic walking group in reducing pain, although the average pain score did improve with the exercise group. So, what did the authors make of this? They found that given the few number of studies, the heterogeneity in the population group, and the variables in the type of interventions, there is low quality evidence to support neither advice education or exercise physical therapy as a more effective intervention. There are some factors that influence the results. With Ryan et al., the advice was different from the other trials in that it was the only study that taught patients about the possible etiology of their pain, as well as providing a back book on how to manage your symptoms, whereas the advice from the other studies were more broad and focused more on encouraging physical activity to lower their pain. The authors further stipulated there is evidence to suggest that when patients understand why they have the pain and not just instructive advice as to what to do with their pain, it empowers them and helps them to make changes. And when patients understand their pain biology, this can lessen their fear and distress and may reassure them to go back to their usual activities. In these 2 studies, not one type of exercise was found to be more effective than the other. Many patients with chronic low back pain tend to have weakness in the trunk muscles, and the majority of exercises that therapists prescribe will work on these muscles, which could be why the interventions were effective despite the exercises having an aerobic focus. There is also research to support that aerobic exercise has been known to enhance protein synthesis and in effect lessen pain. But what could be the case if both interventions were applied? The case against using these 2 interventions is a lack of high-quality evidence, after all. If quality is to go by in asserting effectiveness, a paper from the Lancet Journal found from systematic reviews that the use of exercise and education was found to be effective with moderate quality evidence. This systematic review also mentioned of a previous review that had strong evidence for the combination of the 2. So back to Eva. How can we help assist her in lessening her back pain instead of just giving medication, like what she requested? Perhaps by listening to her concerns and assisting her in finding exercise therapy and giving pain education, we may assist in empowering patients like Eva to manage the chronic low back pain.